Here is your question. Okay, so if you've read and understood, considering its surgical transmission, please
Yes,
tell
ma'am.
me, yes, what exactly are you looking at in picture A and B?
Yes, it's the popliteal fossa.
Right. Please tell me the boundaries of the popliteal fossa.
Okay, above and laterally biceps femoris, above and medially semimembranous and semitendinous, below and lateral head of the gastrocnemius, and below and medial head of the gastrocnemius.
Please tell me the contents of the popliteal fossa from superficial to deep.
Okay, okay. From common peroneal nerve, tibial nerve, popliteal vein, popliteal artery, from superficial to deep.
Right. Popliteal artery, yes. Right, okay. And then there are also popliteal lymph nodes, etc. Right, please identify structures like if you can identify 15 over here, please.
Yes, it's popliteal artery.
Okay, please identify number 12.
Semitendinous muscle.
Yes, and 11.
Semimembranosus.
Okay, please identify number 1 here.
Biceps femoris.
How many heads bicep femoris has?
Two heads, long head and short head.
Okay, please identify, right, 16 here in picture B.
16. Posterior tibial artery.
I'm asking. All right, if you can identify number 9. 9.
Anterior tibial.
It's popliteal artery, it says down there. Okay,
Oh,
what
sorry.
type of joint is knee joint?
It's a compound variety of synovial joint.
Compound or hinge type of synovial type? Synovial
Yes.
joint. All right, please tell me what are the movements which are present at the knee joint?
Flexion and extension.
And
Medial rotation, lateral rotation.
okay, please tell me if you can identify the structures from 1 to 10.
Yes.
What is 1?
One anterior cruciate ligament. 10 is posterior cruciate ligament.
2?
3 is lateral meniscus.
Meniscus, lateral collateral ligament.
Or collateral ligament. Yes, ma'am. Collateral ligament.
And 4 and 3. Okay,
But
if
there
you
is
can quickly.
meniscus maybe
Which
here.
one is menisci? Which one is it?
Maybe 4. Maybe 4.
Okay, if you can quickly
Medial
identify.
meniscus and lateral meniscus.
Yes, in the lower picture, it shows the right knee extension. So what are the structures that you could see now?
Yes,
7, 8, 9, and 6. What are
yes. 9 is anterior cruciate ligament. 8 is anterior cruciate ligament. 9 is posterior cruciate ligament. 6 is medial meniscus. 7 is lateral meniscus.
Okay, right. Please tell me if you could see the structures here present in the anterior aspect and the posterior aspect on the right hand side and the middle. If you could identify all these structures, what is this number 1?
Yes,
C-shape?
lateral condyle of tibia.
No, this is something else. We're discussing knee joint right now.
Yes.
If you can identify all these, can you? Okay, moving here. Can you identify all these? No?
Um,
Okay, right. Then what I can ask you more. Okay, right. If a patient comes to you with the swelling in the popliteal fossa, what are the differential diagnoses that you'll consider?
okay, ma'am. In the skin, it may be the lipoma or sebaceous cyst. In the joint, it may be the Becker cyst. In the popliteal artery, it may be the popliteal artery aneurysm. In the
Yes,
popliteal vein, it may be the popliteal vein varicosities. And in the
yes,
lymph nodes, lymphadenopathy and the nerve schwannoma.
yes. And there are surrounding burst cells as well.
Yes,
So,
bursa. Yes, ma'am.
yes. So what is Baker's cyst?
It is the collection of the synovial membrane in the
Yes,
sac.
yes. And when it gets inflamed, or then it becomes inflammation
Yeah.
of the, yeah, or it's called bursitis. All right, okay. What I more wanted you to tell me, actually, that could have been a very good discussion if you were prepared.
Yes, ma'am.
All right, please tell me, what are the branches of arteria profunda femoris?
Medial and lateral circumflex femoral artery.
Okay, please tell me the branches of the popliteal artery.
Yes, anterior tibial, posterior tibial, and common and peroneal artery.
Lymph nodes in the popliteal fossa drain where?
The skin over the medial malleolus and the deep to the calf muscle area.
Basically they drain from the lateral leg and foot, following the course of the short venous vein. That is important. Okay. Right. Please tell me, how would you do the knee reflex? And what is the root value of knee reflex?
Okay, okay. Root value is L3 and L4, and I ask the patient to make his leg floppy, and
Yes.
I percuss and I expose the thigh, and I hit with the hammer in the uh, popliteal ligament, over the tibial tuberosity, and
Over the
observe the any
tuberosity.
contraction of the quadricep muscle.
Okay. And how would patient react once you're doing the?
The, the contraction of the quadriceps muscle occurs that time.
Okay. Right. Mm, okay. Right. Thank you.